If you've ever had shoulder pain, you know how frustrating it can be because everything we do with our upper body pretty much requires us to move our shoulder. Now, one of the most common things that we see with irritable shoulders or shoulders that have been set off is usually a rotator cuff injury or something that's a bit sore under the acromion, which is a bit of the bony bit that sits underneath here. Now, often you might get a diagnosis of like bursitis or something of that nature, but more often than not, there's some kind of underlying issue with the tendon of the rotator cuff as it comes underneath. Now, we have a couple different muscles that all make up that rotator cuff, which is basically a series of muscles around the joint to provide stability across the shoulder, just due to the fact that it's quite a mobile joint. So we have our supraspinatus, infraspinatus, teres minor, and subscapularis, so a series of those muscles. Most common, we get it with the supraspinatus that gets a bit of an injury, or sometimes, again, that tendon becomes a bit irritated. Now, there's a lot of nuance into whether or not we want to use imaging, and that's something we'll talk about in the role of imaging in a future post. And across this whole series, we'll also look at some exercises and rehab that you can incorporate if you are dealing with a bit of shoulder pain or a rotator cuff injury.